treat the patient, not the tooth. So many times I hear patients come in and talk about situations where they've been at a dental office and they've had a bad experience. And really what it comes down to is that as a clinician, we cannot be so hyper-focused on treating the tooth that we forget that it's attached to a human being. So what I always tell people is treat the human being first, and the tooth second. You can always fix the tooth. Right? Even if you had to abort the procedure and come back the next day because there's something going on with the patient's health or their anxiety or anything, it's much better than pushing through and trying to focus on the task at hand, which is doing the restoration or doing the implant, rather than the patient's experience. Okay, so always treat the patient and manage the patient, and you don't even need to ask the patient how they're doing. All right. So if you're a young dentist and you say, "How are you doing?" you're not paying attention, because people cannot, their nonverbals are screaming at you. They're screaming at you, okay? They're either doing one of two things. They're either fidgeting too much or they're rigid, okay? So if you have a tough guy, he's going to go rigid. He's not going to move at all. It's unnatural. If you see your patient and they're laying there like rigor mortis, okay, then you know there's something going on. He said, then you can just simply ask them, "Mr. Smith, are you feeling any of this?" And if he goes, "Well, yeah, maybe a little bit," okay, then they are. The guy doesn't want to say, "Yeah, I'm feeling it," because he doesn't want to seem like he's being, a wuss, right? He wants to be tough. So you just don't address that. Just say, "Are you feeling that?" If they say maybe a little bit, then they are. Give them some more medicine. Get them numb. It's just that simple. Or if you have somebody who's anxious, and I know that this gets in the way of your daily production, where you have to stop for a minute and set them up, okay? And you have to pause and say, "Why don't you just take a minute to breathe? Just take a couple deep breaths and then change the subject," right? Ask them, "What are you doing for the upcoming summer holiday? Where are you taking the kids? Didn't you say you were going to go to the north during the summer?" And engage them on a personal level and get them to relax. So treat the patient, okay, not the tooth, and then bring them back and then do it again. And you might need to only do that once, because then you showed the patient that you care. And once you show them that you care, a lot of times you can reduce that anxiety enormously by just showing them that you care, that you're not just there to do the tooth job. Treat the patient. So if you're new to dentistry or you're not paying attention, read the nonverbals of your patient. Don't ask them. Don't ask them. You don't need to ask them. Be observant of their nonverbals, okay? And then treat it, address it. Address the patient first. Now, this concept can carry over to when you first meet a patient. So a lot of times what doctors want to do is they want to meet a patient and immediately say, "What's your problem?" And then say, "Okay, I know what to do. I have 3 things you can do. I'm going to give you risks, benefits, and options on this. 1, 2, 3, 4, 5. You give 5 options, and you fail to understand that that's a human being sitting across from you. And so, I never do that. We all know what the patient wants. Everyone watching this channel knows what the patient wants. The patient wants the problem resolved in the most inexpensive way, so that they don't have to come out of pocket too much, but with the longest longevity. That's what they want. And if there's 5 options to fix a tooth, you know exactly which option gives them the best bet for that. If you don't, you need to think about it, okay? Spend some time thinking about the options that you give people are not all equal. To save a tooth, every option that you give them is not all equal. For instance, if someone has a root canal buildup in crown, and the crown, when the crown was done, was really deep and it was close to the bone, the buildup doesn't look good, the root canal looks a little bit shabby, and then now they have a reinfection. Okay, so they're showing an apical, they're symptomatic. You don't know, the tooth may be cracked, but you say this. One of the options is you can go to do a retreat. And after the retreat, we can do another buildup. We can do another crown on a shaky tooth that may be cracked and may not be cracked. It's just not in their best interest. In my opinion, at that point, when the tooth is that far gone, you can do that. You can do that root canal buildup and crown. But when it breaks 3 days later, the patient is extremely upset, especially when you tell them, well, remember option 2 was doing an implant? Well, we can do an implant now. And they go, why didn't you, as a clinician with experience, let me know that this might only last 3 days? And so you don't need to really have that conversation if you've practiced a little bit of time and you understand the real longevity of different solutions that you offer. It's incumbent upon you to provide them that gut check, because at the end of the day, all your options to solve it, we can do hierodontics today, guys. We can save anything. People say, I'm a conservative dentist and I can save anything. Okay, I agree with you. However, if what you did to save the tooth is only going to last a day and it was expensive, you're not treating the patient. You got to treat the patient. You got to say, would you do that to yourself? Would you do that to anyone? Just think about it. It's a human being. They have limited resources and they'd like to spend their money on their family and friends just like you. So we need to look at the patient and say, look, there's a lot of things we can do for this, but I think where you're at in your life, where you're at in your dental journey, and where this tooth is, that the best option is this. This is what I think is the best option. And then go with that and give them the best. So not only are we treating the patient with respect to individual teeth, but we're treating them holistically when they come in, even when we first meet them. This has been another episode of Implants Made Simple. I'm Dr. Robert Stanley. Thanks for watching. If you enjoyed this content, please give us a thumbs up and subscribe and share with your friends.